Welcome back. In this section, we will be talking about some of the practice challenges as social workers and social service professionals we encounter when working with families affected by incarceration. And in this section, we're going to be specifically looking at practice challenges that can occur when working with children of the incarcerated. And with that being said, I'm going to turn it over to Bruce, who will moderate this section.
Welcome back. I've got the pleasure to reintroduce Carrie Kendig, Children's Administration, Child Welfare Services Department Program Manager. Carrie, welcome, and I think you're going to talk about contact, right? Visitation? Excellent.
Yes, thank you, Bruce.
You're welcome.
I'm here today to talk about some research and some issues around visitation. That's children visiting with parents who are incarcerated. So we're going to start with some national data we have about this particular slide. It looks at how many kids do not have time visiting with their parent if they are incarcerated. That the most frequent form of contact is through the mail. The second slide is also based on national data, and it looks at the specific contact between the incarcerated parent and their children. And what we see that stands out is that most kids in foster care do not get visits with their parents who are incarcerated when those visits are facilitated by the caregiver. That the most likely person to provide a visit for these kids is the spouse or the grandmother. So what is beneficial? What are the benefits for children having visits? We've heard from the youth panel about their perspective and how important those visits were. The research also supports the comments from the youth. What we do know is that visits help to reassure the child. It reduces separation anxiety, it provides stabilization, and it is shown to lessen problematic behavior that children might have in out-of-home placement. It also improves outcomes, that timely permanency happens a lot quicker when kids and parents are having visits, whether that permanency outcome is reunification or whether it's adoption or another permanent plan. It's also crucial in maintaining that parent-child attachment. What does Washington state law say about visits? Well, it says that visits are a right of a family when it's in the best interest of the child. So what this means to the social worker is that visits cannot be withheld because the parent is non-compliant with the dependency court order. That most parents who are incarcerated do have court orders, and that we need to do everything we can to make sure that those visits happen. What are some of the potential challenges regarding visits and visits with a parent who is incarcerated? Well, there's always location of the facility. We might have a child who is in foster care in Pierce County with a parent who is incarcerated in Walla Walla. So we need to look at making sure that face-to-face visits happen. They might happen less frequently, but we need to look at other types of contact. We also need to look at a particular facility's policies, practices, and procedures. They vary from facility to facility, and we need to look at the resource guide at the end of this training that gives specific information regarding each facility. We need to partner with DOC in the jails to help us do what we need to do to make sure visits happen. And we also, as social workers, need information about what that facility can provide as visit rooms. We know that some of our facilities have fabulous visit rooms for children, and they're really geared up with activities and things that parents can do to really help them bond, but others don't. And in those cases, social workers have to prepare a little bit more for the visits. and which means maybe bringing some activities for that parent and child to engage in. Some considerations social workers should look at in doing visits and providing visits between parents and children is that being incarcerated is not an automatic safety issue, and which means that just because a parent is incarcerated doesn't mean that safety issues exist in which not to facilitate a visit. In Washington, we do have visit policies that social workers need to look at. And the visit policies support shared planning, shared decision making, which means that when visit plans are created and developed, they should have case participants at the table to look at the special needs of that child and that family, which means specifically that they have to look at any safety issues of the child, but also maybe looking at post-supports for the child and pre-supports. What does the child need before the visit, and what might the child need after the visit? We also want to look at, in creating that plan, what frequency might work best for that child. We talked earlier about the location. So if it's a location that is a long distance, what might work better is visits at a less frequent basis, but using some alternative methods of contact. The other thing that Representative Roberts brought up earlier on the panel is that social workers really need to explore their assumptions about parents who are incarcerated and possibly the children. What's important is that we ask the parent and ask the child whether or not they want visits. We should not just assume that they don't want visits with each other. What we do find is that most of the time, parents say yes and kids say yes. What can we do as social workers and service providers to help children around visits, especially if they are in a facility? A lot of times it's important to talk to the child before they enter the facility, and that to make sure the transporter, whether it be the caregiver, the social worker, or somebody else, is prepared after the visit to help with debriefing. We also know that for youth, it's very helpful that they know of other youth that also have incarcerated parents. What this means is that creating groups where they can talk together is very helpful. The Girl Scouts also has a program behind bars that really helps facilitate this. And we also want to work with our parents. I've talked with some parents at one of our facilities, and they have a lot of anxiety about what they're supposed to tell their children when they come to visit, and they really need some support. And the social worker could be a person to give that parent some things that they might want to say to their child to reassure them that they are okay, to reassure the child that they are loved, but also to let the child know that being in a prison is not a place, a good place to be. And we also want to make sure that we support our caregivers because sometimes after a visit, a child needs some extra support. What do we know about alternate contact? Some of the things that we can do is letters and photos. We know through the national research that most of the contact does happen through letters. It's not the best because we want to provide that face-to-face contact. But when that cannot occur, that we should make sure that kids are sending letters and receiving letters and photos from their parents. But also there's videotaping and there's audio taping. And we ask social workers to be creative to make sure that contact happens because it really increases the well-being of a child in foster care. Thank you, Bruce.
Carrie, thank you so much. Appreciate it. So now our next section is youth, needs, and services.
Thank you. So first we're going to just think a little bit together about this issue. This is an issue, as has been mentioned before, where there's a significant amount of stigma, and it's often a question that's not asked of families who come to the attention of social service providers or social workers. Families might not disclose this issue for fear of stigma or for fear of child welfare or other involvement if that has not occurred. So often this is an issue where we have invisibility, where this is a topic that isn't necessarily discussed. So as social service professionals, we need to both think about how can we broach this issue professionally and personally to try and think about this in creative and thoughtful ways, but also how can we ask the question of families in order to ensure that those needs and concerns are addressed and that families don't have to have fear in that process or have any concerns about further stigma. So some other issues to consider as social service providers, as social workers. There might be a normalization of criminal activity in the family. If there has been a history of intergenerational incarceration in particular, there could be an identification with the incarcerated parent, particularly for teenagers. And again, having visitation and having a better realistic view of what the parent is going through often helps that. And also to go back again to the issue of service coordination, where these are often youth who need or could benefit from multiple service providers working in a concerted way to try and assist the youth. So what are some things that help youth who are facing this issue and dealing with this concern in their lives? One is mentoring, and there's some excellent mentoring organizations that are listed on the resource list. Another important thing to keep in mind, as Annalie mentioned, is listening to the youth and speaking to the youth openly about what's going on and asking them what they need. Also to think about ways of providing peer support, and also, just as importantly, to facilitate effective and appropriate services for parents, and to help them parent to the best of their ability while that they're incarcerated, to help them guide their child. Stability and continuity and placement is very important, as well as early intervention and support. If social service providers are able to ask this question appropriately, we might be able to find out about some of these concerns that families are facing early on before there needs to be more intensive involvement. The resource list is a great place to go to try and connect to some providers, both community providers as well as other agencies that might have some supports. And there's also a website for families impacted by incarceration, a DSHS website, and a DSHS guide to services for families impacted by incarceration called Beyond the Walls, and those are both listed on the resource list. There's also efforts through other agencies, including Department of Corrections, Office of the Superintendent of Public Instruction, Department of Early Learning, and those resources are listed on the resource list as well.
Well, thank you, Miriam. Thank you very much. Next, we have Connecting Youth to Treatment, and I've got the pleasure of introducing Rebecca Kelly from the Mental Health Department. Thank you, Rebecca, very much. Welcome.
Thank you very much.
Yeah.
Well, I would like to talk to you about the mental health services available for children of incarcerated parents. There are two ways that I think that social workers for Children's Administration would need to know the most about, which are for all children who are on Medicaid. That would be children in foster care. All of those children are eligible for mental health crisis services. And there, in your resource guide that Miriam mentioned, there are links to the Mental Health Division website, which will provide you with links to the local crisis response organizations that are in your regions that you're in. Also, inpatient services are available to the public mental health recipient, which is a child on Medicaid. Also, if you believe that a child has a severe emotional challenge, those children are eligible, all children are eligible for an intake with a community mental health agency that is contracted with a regional support network. And the regional support networks are the agencies that are responsible for the public mental health services in the state. The link is found on the resource guide for the Mental Health Division that will provide you with the access to the RSN information. And all RSNs have licensed mental health agencies that are that will provide an intake for all children. If that child is determined to meet the criteria for a severe emotional challenge, they then can access additional mental health services such as psychiatric intake, psychological evaluation, medication management if it's determined that psychotropic medications are required, in-home therapy or in-the-office therapy. And then a specific note for children who have incarcerated parents, we heard earlier about how there are a higher level of exposure to traumatic issues, and many of the licensed mental health agencies across the state now have implemented a program called Trauma-Focused Cognitive Behavioral Therapy, which is in the lingo is TFCBT. And trauma-focused cognitive behavioral therapy is demonstrated by research to really have a positive impact for children who have been exposed to trauma and really significantly reduce the negative effects of trauma for an ongoing basis. So that's something that they don't have to rise to the level of having a post-traumatic stress disorder, but definitely any type of traumatic exposure can be treated with trauma-focused CBT. For children who go through an intake with a community mental health agency and their mental health needs are not found to reach the threshold of a severe emotional challenge, there are also up to 20 counseling sessions that are available a year through Medicaid fee-for-service providers. So if you contact the child's health plan, you can get more information about those 20 sessions. That's a fairly new benefit that has been made available because the legislature has determined that additional mental health resources is a really good thing for children, even if they haven't met the severe emotional challenges threshold. Additionally, it's also really important for folks to know that even children who are not on Medicaid and their families, they're allowed access to the mental health crisis system. So regardless of your income or whether or not you're on Medicaid, you are entitled to have access to the crisis mental health system as well as inpatient services if you've been determined to meet the criteria for inpatient services. And if a family or a child is not on Medicaid and there are no other benefits through private insurance, you could check into community social service agencies. Some might have sliding scale fees for mental health services that would be available to children, specifically those with incarcerated parents. There also can be other resources available, special programs, groups, or activities for kids and their caregivers that could be a positive or helpful thing. You can contact the local community referral lines for something that's specific to what you're looking for. And then finally, the last thing that's available to anybody, all parents or caregivers, regardless of whether or not you're on Medicaid, are for parents or caregivers with children with mental health issues. There are some parent support programs that are specifically targeted for children with mental health issues. And the Mental Health Division for the state of Washington has a parent advocate who is someone who can be a help or a liaison to parents and guardians as a support to a child or family and helping to connect them to other services in their community if they're really struggling to find where they can get access to services. And that information is also on the resource page. Additionally, SAFE Washington, which stands for the Statewide Action for Family Empowerment of Washington, is another parent support organization that offers resources and support for help to navigate the system. And it's from people who have been there, from other parents who have also had children with mental health needs. And they are a really wonderful organization that is a very it's a peer-to-peer support that is a very positive thing for many parents who have children with mental health issues. So that's a brief overview of the mental health system.
Well, Rebecca, that was fantastic. One quick question I have for you. On the 20 sessions, first I've heard of that. Mm-hmm. So you said to a fee-for-service, does Medicaid pay for the whole thing, or is it still a sliding fee scale for those 20
It's a
sessions?
Medicaid fee-for-service program.
Okay.
So it's completely paid for Medicaid,
Okay.
by Medicaid, yes. So if a child is enrolled in Healthy Options or one of the other health care plans through Medicaid, there are now up to 20 sessions. I think before it used to be 12, and now that's up to 20 sessions where a child could access mental health services. It's a really nice way to be more preventative than having to reach the specific disability criteria that the regional support networks and the public mental health system require.
Fantastic. So the next we have is Chemical Dependency Treatment Prevention Services, and I'd like to introduce Tina Burrell of the Department of Alcohol and Substance Abuse. Hello, Tina, and thank you for being here.
You're welcome. So today I want to talk about our system, youth treatment services that are available in Washington State. Division of Alcohol and Substance Abuse supports prevention, intervention, treatment, and aftercare services. And I just want to introduce sort of what we have to offer in the state and how to navigate that system. Prevention is a great opportunity to provide a moment of encouragement for youth that are dealing with incarcerated parents. We heard that earlier today from our youth panel, is that we want to have encouragement and supporting opportunities. And DASA contracts with counties and tribes and the Office of the Superintendent of Public Instructions to provide these services. And we're happy to say that in 2008, approximately 24,000 youth participated in reoccurring services in the state. And this is a time to have youth sort of enter into these services, have linkage between the social worker and the schools perhaps, to encourage them to participate, increasing the protective factors around them because we know they're at a vulnerable position right now. So prevention is available. We have universal activities, selected and indicated activities. So if this student or youth is sort of acting out, we can move them through the system into a higher needs service. Intervention is also available. It'd be a school-based opportunity. This is we might see some trauma-specific or trauma-focused services for youth at this time. One of the things that you'll want to do as a social worker is check the resource guide at the end. You're going to check with the prevention managers through the Division of Alcohol and Substance Abuse to find out what services are available in your area. For example, in Thurston County, Grace Harbor County, and Lewis County, there's services that's called cognitive behavioral intervention for trauma in schools. And so this would be working with a youth that has had traumatic exposure and they're able to receive services in the school. Perhaps they've not gotten to a level where they have PTSD, but they can have some support in their own environment. And there's a variety of programs available through the prevention intervention, and you want to go down to a local level and find out what the child that you're working with, the youth that you're working with, what would meet their needs.
Do you know if that's in the resource book in terms of how to get a hold of a local provider or how to hook up with one?
Well, on our resource guide, we're going to have a number of options. There's a book called, we call it the Green Book, and that can give you statewide access, but we also have one specific for youth, so that's a resource and referral guide for adolescent services, and we have 137 outpatient agencies in the state, so there'll be direct information about that. And we also have a guide for parents and caregivers, so it has some specific answers around age of consent, BECA bill questions, what to expect in inpatient and outpatient services. So those will be available. They're on the website for DASA, but we'll also have them linked with this information as well. I do want to talk about some treatment services that are available. In Washington State, we have outpatient services, and this would be a social worker would want to contact. You can contact the Teen Line. It's a referral source. It's a 1-800 number. You talk to a student assistance professional in your school if there's provided, and 222 districts have them across the state, and sort of link up with an assessment for services to support the youth if they are sort of encountering use or misuse. And studies have shown that after traumatic experience, that substance abuse increases 25 to 76%. So we know that this population is at a vulnerable time, so we want to be looking after their health, putting some protective factors around them, or perhaps getting them services that they need. Also, we have 12 inpatient facilities in the state if a youth is in need of inpatient services. And we emphasize that our programs, DASA certifies programs that are culturally relevant, family focused, but provide individualized treatment services. So we expect when a child comes into those services, a youth comes into those services, that the family unit will be considered. And we are doing some awareness building around this population and the special needs of this family and population. We'll be rolling out a toolkit with the Mental Health Division. So agencies within the system are doing the same work that the Children's Administration is doing to remember that we have specific needs to meet with this population. But they're already embedded within our treatment agencies doing good family work, and we'll be providing the opportunity to create that communication. And perhaps it's thinking outside of the box on how to make that linkage happen. If a parent is incarcerated, you know, there can be alternate letters written, perhaps photos, different ways to make sure that the family feels intact when appropriate. And the other piece about treatment is that there's a release of information. So the child is informed. They give permission on who they want to have involved in this process, and so if they are advocating to bring that parent in, the treatment center is going to work to make that happen. The last piece in the continuum of care is recovery houses, and it's an opportunity for a youth to try living on their own with some structure, living on their own in the sense that they get to go back into school. They would access this service after inpatient treatment, and they get to go back to school, maybe get a job, but to see how they're doing with their own sobriety. Now, we know drug and alcohol impacts the families significantly. We saw that information earlier. So this is an opportunity, again, for the family to grow and learn about the relapse prevention skills. We only have 4 recovery houses in the state. And it's, you know, it's a resource that's definitely needed.
Tina, thank you so much. You're fantastic.
Well, thank you.
So the next part we're going to be talking about is youth and juvenile rehabilitation. And I've got the pleasure of introducing Pamela Sachs-Lawler. Well, welcome, Pamela, and what can you tell us?
Okay, I was listening earlier to Representative Roberts, I believe it was, who asked, what is the goal of incarceration? And this goes to the very core of the vision and mission of JRA. Our vision is to contribute to the quality of life in Washington State, the use of our leadership, resources, and commitment of our staff to strengthen communities and services to juvenile offenders. Well, what's our mission? Our mission is to protect the public, hold juvenile offenders accountable for their crimes, and reduce criminal behavior through a continuum of preventive and transition programs in residential and community setting. So I want to talk a little bit about what our population looks like within JRA. About 1,000 youth are committed annually to JRA by county juvenile courts in Washington State. So today, our census is, in our institutions, we have 635 youth. In our community facilities, which is somewhat of a step down from the institutions, we have 71 youth. And currently on parole, we have 677 youth. So keeping that in mind, JRA is structured a little bit different. So I'll talk about the structure in the different divisions within JRA. The Division of Institution Programs oversees 3 institutions: 1 youth camp and 1 basic training camp. When our youth are placed in our residential facilities, they're assessed to determine what the treatment needs are. So we're going to take a look at what kind of services do they need. Do they need mental health treatment? Do they need substance abuse treatment? So they're assessed. JRA utilizes an evidence-based treatment model which teaches behavior skills, and it helps the kids to change their behavior. It teaches them skills to change their behavior. They learn to handle and tolerate distress, solve problems, and manage their anger, and that's a big one for kids who are in this kind of system, where a lot of the kids have never been able to handle their anger, and so therefore they take out their anger on other people. Well, JRA utilizes dialectic behavioral therapy, which is an evidence-based program, DBT, which gives the children the tools in order to handle those types of situations. Institutions also provide academic and vocational programs, healthcare and mental health services, as well as substance abuse treatment. We have our own substance abuse treatment programs within our institutions. The Division of Community Programs manages parole services, 6 community residential facilities, also referred to as group homes, and these are located throughout the state. And they contract with 2 privately operated community facilities. Community facilities offer youth the chance to practice these skills that they learn, the DBT skills that they learn within the institutions. Youth finishing their sentence in a community facility live in a minimum security, but highly structured setting, and are able to attend local schools and or work in the nearby community. This is really powerful. I've visited some of the community facilities and I've seen the work that they do within the community facilities, and it's really empowering to those youth. Typically, youth and families receive between 5 and 6 months of services when they're on parole. The next division would be the Division of Treatment and Intergovernmental Programs, which is also called DTIP. It's responsible for developing treatment program policy and standards and managing and monitoring state and federal grants and contracts. DTIP led the effort in implementing our model, the Integrated Treatment Model, which is a toolkit of evidence-based programs to help our children. Additionally, DTIP administers the Interstate Compact Program to ensure cooperative supervision of youth on probation and parole as they move between Washington and other states, and facilitates the return of out-of-state escapees, absconders, and runaways. DTIP also works with county juvenile courts through the state. Now, I want to talk a little bit about our visitation policies. I've talked to you a little bit about what our structure is, the different divisions, and what type of services we provide. Although our population is under 21 years of age, there's a percentage of them that are also parents. And that's pretty amazing to some people, but we have youth who are parents, who are incarcerated. And so this impacts the youth, their children, his or her life. So we need to take a look at that when we're talking about children and families of incarcerated parents. Carrie talked about also the benefits of visitation. Visitation is very powerful. It's important for families to stay in contact with their children and for children to stay in contact with their families. JRA recognizes the importance of maintaining healthy relationships within the family setting. While our youth are incarcerated, there is still a need to continue communications with family members. As such, JRA takes a holistic approach in providing services to our youth population. One example, after youth complete their residential commitment, which means that they have been in the institution and now they're in a community facility, youth are placed on functional family parole, FFP. The focus of FFP is the youth's entire family. Services are designed to engage a youth's family in supporting and reinforcing the positive gains he or she has made during their residential stay in an institution. JRA parole counselors work with youth and their families on a regular basis during the youth's time on parole. Most youth spend 5 to 6 months on parole. Some sex offenders are on parole for 24 to 36 months. JRA's institutions and community facilities have maintained clear visitation policies. However, these are somewhat different because each region or each institution or community program has had their own policies. Okay? Community facilities have allowed youth to have their parents come to visit them. And you also are allowed to have the youth of the youth that is incarcerated, so their child can also come and visit. I think it's important. Sitting on the Children and Families of Incarcerated Parents work group over the last year has really enlightened me a lot as to what the issues are surrounding the youth who are also incarcerated. So we need to recognize that although we have youth who are incarcerated, they're also parents also. And their children may be younger, but they also need contact with their youth. As a result of the Children and Family of Incarcerated Parents efforts with DSHS, JRA currently is working on one combined visitation policy that successfully addresses the needs of children and families of incarcerated parents. There's also an effort underway to implement our tracking system within JRA is called ACT. It's an automated client tracking system. So we're going to put information on each of our youth. We want to document if they have children, what their children's names are, and where their children are currently located while their parents are in our facilities, as well as we want to be able to document if our children have parents who are incarcerated, so we can keep track of that for visitation purposes. Now, when I thought about resources, I kind of wanted to say that JRA is, we have a mentoring program. So in each of our region, we have 6 regions, we have a mentoring coordinator. And our mentoring coordinator kind of coordinates mentoring services for the kids who are in the community facilities as well as the kids who are in the institutions. So you match them with someone who may be a good mentor to them. So we have 6 mentoring coordinators. We have a statewide mentor coordinator that oversees all of our programs. We also have, as I mentioned earlier, we have our own drug treatment programs. And we also pair with the local drug treatment programs. Once a child has left the institution and went into community facilities and still may need drug treatment, we pair with local substance abuse agencies in order to get our kids the services that they need, as well as mental health services. And the contact in the regions would be the regional administrator. Thank you.
Hey, thank you, Pamela. Thank you very much.
Thank you.
Take care. So the next is victim witness concerns, and this will be Elisa May, Department of Social Health Services, Office of Government and Constituent Relations. Thank you very much for being here.
Thank you. Well, the Victim Witness Notification Program was established back in 1990 as part of the Community Protection Act. Our program provides notification to victims and witnesses when offenders are committed to our facilities. Those facilities include the Special Commitment Center for Sexually Violent Predators, and that's a facility that's over on McNeil Island. We also cover notification for the 2 state mental health hospitals, Eastern State and Western State Hospital, and then all of the JRA facilities that Pamela was talking about, Green Hill School, Maple Lane, Echo Glen Children's Center, and Naysell Youth Camp, along with all the community programs she was referring to. To enroll in our program, all you need to do is complete an enrollment form. You can access those by contacting our office at our toll-free number. You can also access it by going onto our website and enrolling online, or through your county prosecuting attorney's victim assistance unit. They also have our enrollment forms. In addition to notification, not only through DSHS, but through the Department of Corrections and through the local jails, the city and county jails, you can also get notification. Along with notification, there are a number of other crime victim services that may be available to somebody that you're working with. To access those, please check out the resource list that Miriam mentioned earlier.
So this service is primarily for victims, correct?
Correct. Victims and witnesses, and also anybody that is specified in writing by the prosecuting attorney. So if for some reason you're a social worker and you need to know about a certain offender that's committed to one of our facilities, please check with our office. We may be able to enroll you or a foster parent for notification. We'd be happy to assist if you need community resources for victims of crime. Please contact our office and we will assist you with that process.
Yeah. Well, Lisa, thank you very much. Take care. Okay, so that now brings us to April Rivera, CASA Guardian Ad Litem, ensuring youth voices are heard in the child welfare process. So good to see you, April.
Nice to meet you, Bruce. The King County CASA program was started approximately 30 years ago in response to a Superior Court concern that children's voices weren't being heard in the courtroom and that they're making very important decisions about these children's lives without hearing enough background and investigation. So by statute, we are appointed, we're a party at the table, the same as the parents and the social worker. We're allowed to contact the children's teachers, the other adults involved in their lives. We have access to medical records. And also by statute, this is new, but we are required to ask the children what their express wishes are on a variety of topics, including permanence. This obviously can be a touchy topic, as Miriam was referring to earlier. So certainly we hold trainings for our CASA volunteers on how to address difficult topics with children and to try to not add any more trauma to the situations that they're already in. We talk a lot about building resilience for our children, particularly our youth in foster care, and clearly for children, knowing who your people are, particularly when you're not placed with them, is of the utmost importance. The CASA has an odd role in a way because we are advocating for the child's best interests. I can't guarantee that in every situation a CASA will think it's appropriate for a child to have person-to-person contact with a parent who's incarcerated. These cases are all very individual. In the King County, we have approximately 360 CASAs. We serve around 1,000 children. Statewide, I believe we have 2,200 CASAs, and we serve around 7,000 children. We are very active. We are a volunteer-dependent program. If anyone is interested either in volunteering or in trying to be the squeaky wheel to get a volunteer appointed to a child who is in foster care, we can be found at the National CASA website, the Washington State CASA website, and all of the larger counties in Washington have them as well.
Well, April, thank you very, very much.
Thank you.
Very helpful.